Good afternoon. My name is Kevin O'Connor, and this is my Health Promotion Framework presentation for DMSC 7020, Social Determinants of Health. The purpose of this Health Promotion Framework is to bridge the gap in access to opioid use treatment in rural Virginia. Opioid use disorder is a nationwide problem. In 2020, nearly 2.7 million people over age 12 had an opioid use disorder in the previous 12 months. Additionally, rates of opioid overdose quadrupled from 1999 through 2016, then increased again in 2020. Access to treatment for opioid use disorder is limited. In 2017, over 70% of patients who needed treatment for opioid use disorder did not receive it. Access to medications for opioid use disorder is even more restricted, with only 36% of treatment programs offering medication. While there has been an upward trend in the availability of treatment since 2017, medications to treat opioid use disorder remain underutilized. Improving access to treatment is one of 5 priorities announced by the Secretary of Health and Human Services in 2017 to address the opioid use disorder epidemic. The state of Virginia has not been spared from the opioid epidemic. As you can see here, emergency department visits for drug overdose are prevalent throughout the state. Notably, emergency department utilization for all causes was less during the COVID-19 pandemic than in previous years, so our ability to assess for current trends is limited. This graphic from the Virginia Department of Health shows that emergency department visits for opioid overdose and death from opioid overdose have increased from 2019. In 2020, an average of 4 Virginians died of an opioid overdose every day. One treatment strategy that was developed to improve access to care is the ED Bridge program. In this model, the emergency department becomes a primary access point for the treatment of opioid use disorder. The goal of the program is to improve access to treatment by initiating medications to treat opioid use disorder in the emergency department while connecting the patient to an addiction treatment program. In most cases, treatment is initiated with buprenorphine, which can be used to treat opioid withdrawal and opioid use. Benefits of the ED Bridge model include decreased emergency department utilization and long-term adherence to opioid addiction treatment. An ED Bridge program in Syracuse, New York, reported that for 269 patients who were initiated on buprenorphine in the emergency department, 56% remained on medication treatment 2 years later, and emergency department utilization decreased by 58% in the 6 months before and after initiation of treatment. While the emergency department may not seem like the ideal location for initiating opioid treatment, it is uniquely resourced to provide this service. Emergency departments are highly visible, easy to access, and are often located on public transportation routes. Additionally, they offer care at all hours and provide critical services related to addiction, like acute psychiatric stabilization. Emergency departments also excel at connecting patients to ongoing care and community resources. Patients that may benefit from the ED Bridge program include those who have sought care in the emergency department for opioid detox and are actively seeking treatment for their use, in addition to patients that may not be as motivated. Patients that have been resuscitated post-overdose should be made aware of the option to start medical treatment and be referred for ongoing addiction services. Also, patients who display high-risk opioid use and drug-seeking behaviors can be offered medication for opioid use disorder and bridged to a treatment program. The proposal presented here is to establish an ED Bridge program at Rappahannock Hospital in Kilmarnock, Virginia. The hospital serves 2 counties with a total population of nearly 22,700 people. The area is very rural and has a stagnant economy. General access to care is substandard, and around 12 to 13% of the population lack health care. The 2 closest addiction treatment programs are 29 and 38 miles away. While these distances are not insurmountable, they make it harder to access care, especially for individuals with low income, limited transportation, medical comorbidities, and who may be experiencing the effects of opioid withdrawal. To achieve the goal of bridging treatment, a partnership would be established with an outpatient addiction clinic offering medications for opioid use disorder, such as the Master Center for Addiction Medicine in Gloucester, Virginia. The partnership would consist of a streamlined referral process and priority access for emergency department referrals, including telehealth appointments. To ensure stakeholder buy-in, the emergency department providers would undergo training on the SBRIT approach, which is an early intervention strategy to treat substance use disorder. They would also undergo training on buprenorphine induction. The proposal to implement the bridge model at Rappahannock General Hospital targets several social determinants of health. The model provides a solution to the lack of addiction programs offering medical treatment in the built environment of rural Virginia. It also addresses an ongoing healthcare crisis for which resources are limited but specialty care is needed. The proposal also acknowledges the community context by offering telehealth services in an area where public transportation is restricted and patients must often travel long distances for care. Emergency departments across the United States are on the front lines of the opioid epidemic, as more patients seek care for both opioid overdose and opioid withdrawal. In response, many emergency providers have started initiating medications for opioid use disorder. One of the many challenges of this strategy is finding appropriate referral sources once patients are discharged. Creating partnerships with local opioid addiction treatment programs may help patients address the social determinants that impact their access to care and improve long-term outcomes for patients with opioid use disorder.